Okay, 1.4 million, 1.4 million new cases of cancer in India. So if that rate will continue, obviously we are going to come at the top 10 of the cancer prevalent countries. So most common cancer worldwide is lung cancer, following breast cancer. But in India, most common cancer is oral cancer because of our habits and all. Oral cancer, head and neck cancer. Then comes in male lung cancer. And in female, it comes first ranking is breast cancer, then cervical cancer. So today's talk, actually our doctor will point out this common cancer. The thing is, cancer are two types. One are genetic and another is non-genetic. Genetic cancer, hardly 5 to 10% cancers are genetic. Okay, that comes with certain kind of syndrome. If person is having that, suppose you are having, someone is having breast cancer. Okay. So once doctor will check, they will check you for particular gene also, that is called BRCA gene and all. If that is positive, there are chances that other people in family may have cancer. So according to that, other people will be counseled. Okay, certain syndromes are there, Lynch syndrome, Love-Romani syndrome. With those syndromes, if identified, there are chances that you will develop cancer, and in family also, chances of cancer will be there. Okay, so these things your doctor will identify and counsel. But these cases are 5 to 10% only. 90 to 95 happens because of environmental factors. Because of environmental factor, gene dysregulation happens and abnormal cell growth happens and it leads to cancer. So today we are going to focus the common cancer which is prevalent in India. How to identify, what precaution we need to take, when to see the doctor. Our doctor will inform you about that. Okay, Dr. Jagdish will take about the oral and
followed by the most common cancer is lung cancer. Lung cancer actually males more than females due to males more smoking. The main reason is smoking is the main cause for lung cancer. Also male and the males. But what is the causes? One is smoking. Another patient have any COPD, any lung disease, they have risk. Also patient cause ionizing radiation. So some industries cause radiation, they will do radiation. They use some happen like that regular. So they have some risk to take lung cancer, smoking, ionizing radiation, also occupational lung diseases, asbestosis, silica, and nickel. There will be some companies like that. They are prone to work prone to lung cancer. Also patients have a risk of COPD and interstitial lung disease. They have to prone lung cancer. Genetic is very difficult to tell. Genetic is very difficult to make diagnosis, difficult to treat. To already got nothing, but something is cannot reverse is and telling to smoking and any occupational diseases. Clinic not there.
Can you expand the COPD and IPD? I'm not very
COPD means chronic obstructive pulmonary disease caused by most commonly smoking, and the second cause alpha-1 antitrypsin deficiency. Most commonly smoking. ILD is corona, interstitial lung disease. ILD one of the is corona and asbestosis, silicosis, nickel. Some documents cause ILD. The main point is who is the risk they come to one-time CT scan. All people not required. Red. You have to immediately show to general surgeon. Make the general surgeon only. Not a person. All three is not mentioned, but repeatedly not able to get. Everybody will got, but the frequency not very more. Very small maximum nothing to worry. Small size very small maximum nothing to worry. But size big to look into it. Size very small no. Size big you have to look into it. Understand? Size small nothing to worry. Big you look into it. Also, every person go to mirror. They go to self-examination. Important. Go to mirror. So they have examination also. They have initially do like that. Next do like that. And like you have to procedure. Every person go to main is program, screen program is self-examination main screening program. Test not there.
One more important thing in oral examination, that 3-finger test. Okay, that you can open your mouth as outline, you can accommodate 3 fingers. If that opening is becoming less, okay, So there may be two causes, that TMJ, this arthritis also is possible, and submucosal fibrosis is possible. So anything you are noticing that your mouth is not opening properly, please check the doctor.
Main point is stop smoking alcohol. Main point is cleaning is oral self-examination. Nobody can tell you unless you have awareness.
Most common cancer in females. So do you think it can happen in males? Yes, it can happen in males also. So I believe all of you are going to hear it thoroughly. So okay, what is the problem in the patient? We have all heard, okay, she is having breast cancer, or your neighbor is having breast cancer, your relative is having breast cancer. So what is the problem? How is she going to present? So the main problem is she may see a lump, like a swelling, while doing something. It will be accidentally getting noticed. And you go to a doctor, they will do further examination. So how do you examine, or how do you understand that there is a problem? You can do this when you are bathing. Just look at a mirror and see if there is, first of all you see, is there any asymmetry, like oh your nipple is in the correct position, or if there is any problem with the nipple, like some cracks, some discharge. See if there is anything